We're joined now by the World Health Organization's lead expert on COVID-19, Dr. Maria VanKerkhove. Doctor, thank you so much for joining us this morning. You lead the WHO's Emerging Diseases Unit. You've been on the front lines of this fight since the very beginning. After 7 months, more than 15 million cases worldwide, where do things stand? Are we controlling the virus, or is the virus controlling us?
So good morning, George, and thanks for having me on the show. That's an excellent question. Right now, the virus is controlling us in many parts of the world. We're seeing quite some worrying trends in many parts of the world, where many countries are seeing, really increased transmission, intense transmission. Much of the Americas right now are really in the thick of it. But we do see signs of hope. In some countries, they have been able to control the virus. This virus is controllable with the steps that are outlined with this whole comprehensive approach that we've been talking about since the beginning of this pandemic. And we've seen many countries have success. So I think there is an element of hope that everybody needs to understand. Even countries that are really overwhelmed right now can turn this around. They can and they will turn this around.
Let me press you on that, because almost half the world's cases now are coming from just 3 countries, the United States, India, and Brazil. We have seen the curve flatten in parts of Europe and Asia, although there's some resurgence in some of those countries right now. How do you explain the difference?
Well, there are quite some differences in countries in the way that they've responded to this pandemic. What we do know, what works consistently in high-income countries, low-income countries, north, south, urban, rural populations, is a comprehensive approach. It's this quick isolation, identification, care of patients, of cases, even cases that have mild disease or who are asymptomatic. Putting them in isolation prevents them from passing it to someone else. Contact tracing, finding contacts of confirmed cases, putting them in quarantine, whether this is in a special quarantine facility or quarantining at home, empowering your population, letting them know, where is this virus, what can you do, what can I do to prevent myself from infection, making sure that this is an all-of-government approach. This is not just a health sector response, this is an all-of-government approach, meaning that every sector needs to be involved. But I think most importantly, as I've already mentioned, is really empowering communities, empowering individuals so that they know what they can do to prevent themselves from getting infected. And this is the package of interventions. It's physical distancing, it's cleaning your hands, it's wearing a mask where appropriate, it's being vigilant, being alert, being aware, and really being kind.
Here in the United States, there's so much concern about back to school coming up in just the next few weeks. The CDC released additional guidance on reopening schools, saying the best evidence shows that COVID-19 poses relatively low risk to school-age children and that COVID-19 transmission among children in schools may be low. How do you assess the risks of sending kids back to the classroom right now?
Well, there's a lot that we're learning about children with this virus. The good news for children is that overwhelmingly among children that are reported to have been infected, most of them have mild disease. So that is very lucky. That is very good news. However, there are some children that develop severe disease, and unfortunately there are some children who have died. We're learning now about transmission among children. I think there's quite some open questions about how this virus transmits among children and between children and from children of different ages. What we're learning from some of the studies is that there is a difference between the youngest children, so for example, those under 10 years old or 12 years old, and those over 12, above 10, above 12 years old. And there may be differences in their infection rates, and there may be differences in their ability to travel. But one thing to remember when we think about schools is that schools are part of communities. And so if there's transmission that's happening in communities, there's transmission that can happen in schools. We can't think of them only as an isolated facility. And so when we think about reopening schools, because schools are incredibly important, and I know everyone across the world knows the importance not only for education, but for mental health, for social, for food, for safety. There's a number of considerations that the decision makers need to take into account. But importantly, what does transmission look like in the area of where those schools are? That is absolutely critical, because schools are part of that community. And it's not only the children themselves, it's the people that work at those facilities as well. And these, of course, are adults.
Dr. VanKerkhove, thanks very much for your time this morning.
Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here. to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.